My co-host Hazuri and I are excited to be here today and even more excited to start our conversation. Our guest today is Kelly Davis. Kelly Davis is the Associate Vice President of Peer and Youth Advocacy at Mental Health America, where she works to expand peer support and other programs, policies, and research around youth and young adults. In 2019, Kelly was awarded the Disruptive Innovator Award by the International Association of Peer Supporters, which is an award given to a young person making positive change in mental health through positive disruption. She's also a certified yoga teacher and holds a certificate in applied positive psychology from the Flourishing Center. She's currently pursuing her master's degree in nonprofit leadership at the University of Pennsylvania. Kelly, anything that we've missed that you'd like for us to add?
No, I think the biggest thing that I would say about my work and the history of Mental Health America as an organization is perspectives and advocacy being grounded in lived experience. So I've done a lot of things and gotten connected to a lot of people through my work, but I think the core of what I feel is important is my personal lived experience and how everyone's lived experience can contribute to their advocacy.
Well, what an impressive background, Kelly. We're so happy that you're with us today, and we can't wait to dig into what you just shared. There's clearly a lot to talk about. Still, let's talk.
I'd like to start our BeingMe podcasts by asking you to tell us a little bit about teenage Kelly. Were you shy? Did you participate in school activities, sports, debate? What was teen Kelly like?
I think teenage me was a few things. And on the surface and maybe to outsiders in some ways, I think I looked like I was doing really well. I did well in school. I played sports. I did theater, a lot of different activities, mostly in middle school and the beginning of high school. But at the same time, I was dealing with really serious mental health challenges, including depression, anxiety, eating disorders, and substance use. So the second half of my high school career and teenage years, including the start of college, were more marked by how much I was struggling, even though I still went to school and was interested in politics and advocacy and those kinds of things. My experience as a teenager was really impacted by my challenges with mental health.
And I appreciate you sharing that with us. We've heard that from a lot of teens. We've heard it from a lot of the guests that we've had on our podcast as well about this gap between what other people saw and how they might have appeared versus what people internally were really struggling with behind the scenes. So again, so appreciate you sharing that. And we have a lot of different things that we wanted to cover today, but I wanted to start with talking a little bit more about your role at Mental Health America as the Associate Vice President of Peer and Youth Advocacy. Can you share a little bit about the mission of Mental Health America and the work that you do as a mental health advocate and what communities you serve?
Absolutely. So one of the things that I hinted at before was Mental Health America is actually a very old organization. It was founded in 1909 by a young person who had been in and out of the state mental health hospitals of the late 1800s.
Oh, wow.
Very atrocious. Yeah. His name was Clifford Beers, and he's considered one of the founders of the mental health movement in the U.S. So that's our history. It's really about lived experience. And then our symbol is the bell of hope. But the bell of hope is actually made from the melted down shackles from state hospitals post deinstitutionalization. So yeah, our history is it's very much about human rights and empowerment. And our current mission is really about improving the mental health of all and making sure mental health resources are available for those who need them. And on top of that, it's not just about access to services or improving services, but it's also about creating a world that doesn't harm people's mental health.
Sure. The work that you do, just given what you've just shared, sounds like it's more than just a job for you. I can tell that you're very, very passionate. Where did that passion come from? Where has your own personal mission-driven focus come from in this work? What inspired you to do the work?
Yeah, so I will say quickly, I think my work right now is very tied to my personal experience. So I would lump my work into 4 buckets. So one is youth leadership, one is youth peer support, one is disability in higher education, and one is young people in mental health policymaking. I really struggled as a child, even with mental health. And I had my first suicide attempt when I was 10. So my life was really dominated by mental health challenges. And when I was 19, I was kind of given the message that people like you don't do well in the world. You should probably drop out of college and go home. And I got connected to the peer support movement and the history of people with lived experience in the US who for decades have been driving change in mental health. And I had never even been exposed to the idea that people like me as a young person had answers and solutions. And also that there's a thing called disability in mental health, and disability accommodations absolutely were the reason why I graduated college. So my work is essentially what I saw were major gaps in my experience. And the more I talked about it, the more I found out that it actually wasn't just me. It was many of the people around me.
Absolutely. And I think that concept of knowing that you're not alone in any of these challenges and in any of the ways in which each of us might struggle day to day with some of the small things, with some of the big things, it's just so important.
Totally. Can you share some more about how you work with young people and how you include them in your work? What does that look like day to day?
Yeah. So one of the major programs that I started at MHA is our youth leadership program. It was designed to fill this gap where when I was in college and when I was first getting started, I was like, there have to be young people doing cool stuff, but I have no idea where they are or what they're doing. So the council was designed to create basically try to create some centralized resources that brought together young people who were creating innovative programs, whether they were policy initiatives, peer support programs, mental health apps, all different things, to come together and to also be able to document and spread their programs and document and share their perspectives. So that is something that we do on an ongoing basis every year. We're actually about to open up the applications for this upcoming year in the summer, so I can pass that along as well. Then it varies. I think I'm really passionate about young people and lived experience perspectives and research. So have done a number of projects trying to understand and explore what it's really like to be a young person navigating policy, navigating college, navigating community resources and the pandemic. So done a number of projects like that. And then last year, we co-hosted a virtual 2-day summit with YouTube that was all about how do you go from awareness to action in mental health. So we had 2 days. We had over 40 youth and young adult mental health activists talk about their programs and what they've learned and how other people can get involved in those. So I'm very passionate about social movement and mental health as a social movement, where the point is to spread ideas because people in their communities really understand what's happening and what needs to change. So we need to spread those ideas as far and fast in the most empowering ways possible.
We spend so much time talking about the awareness side of things and the problem, and I think often not enough about the solutions and what to do. And as you said, how to take action. If there's any learnings that you would like to share that particularly resonated with you from some of those summits and some of the work that you've done, we'd love to hear them.
I think one of the biggest things, and it's also in terms of being able to follow it with resources, a paper that I recently worked on that's going to come out soon is the power of young people and being able to support one another. So definitely not the only thing, right? We want to improve access to mental health education and resources from teachers, from mental health professionals, access to psychiatrists, all the things that young people need. But I think the ability for young people to support one another, where that's mostly who they're turning to anyway when they're having a hard time, has been really underutilized. And whether that is general mental health training of a lot of my friends are having a hard time and they talk to me about it and I have no idea what to do. Can someone tell me like what language to use, what's good to say, what might be hurtful versus different types of clubs. So for example, and we do actually have examples of clubs in athletics where older students will learn basics of mental health education, positive psychology, and mentoring and support younger folks in their programs, or at the most formal level, using and training young people, mostly folks in their 20s, to support teens and young adults in navigating juvenile justice, returning to community, inpatient mental health services. So I think that basically anywhere someone falls on the spectrum or in the community, there's ways that we can partner with young people and empower them to create better relationships, to create better services, and to build better communities.
Can you share with us the importance of peer support and anything you'd like to share from your background that highlights how powerful this type of support can be? We'd love to hear about the work that you're doing in this space.
Yeah, I think there's so much that is powerful about peer support. One of the core things is knowing you're not alone. I think it often feels like when you're struggling, you are the only person who is. I talk about a lot when I share my story. It was not only for whatever reason that I didn't understand. I felt like other people could hold it together and deal with whatever they were dealing with. And for some reason, there was something wrong with me that I couldn't. And that wasn't the only problem. Whatever I was dealing with was so bad that talking about going to therapy and the places where I spent all this time trying to figure out was bad too. And I couldn't talk about that. So it was this heavy weight of not being able to say how you're feeling and all the things that are happening to you. So I think that's critical, is being able to be open and honest about your experience, to connect with other people. I think the other piece, and there's a little bit of distinction between peer support, right? So I want to be able to talk to my friends about how I'm feeling, and I want to be able to respond to my friend, maybe if they're talking about thoughts of suicide or something. But on the more formal mentorship, peer support specialist side of things, having peer supporters and peer services is a sense of hope. Seeing somebody who's been there and been in the same space, who's moved through it, who's living a life that they maybe didn't think they'd be able to live. I think hope is so powerful in being able to move forward and take steps that I think connection and hope are just critical for everybody, but especially when you're struggling with your mental health.
Absolutely. And some people are able to think of their future selves and their future lives and what that might look like and use that as a source of hope. But from what I've heard from teens and from kids and even from other adults that I've worked with, is that's not easy. And I think the vast majority finds it much easier to connect with other people, as you said, who have already worked through similar things so that they know, hey, I'm not alone in this experience and there is another side. There is light at the end. There is hope. I'm not always going to feel the way I do right now. The situation is going to change. And I think that is just immensely powerful.
Absolutely. I shared that too. It was my experience. And it's even worse now when you're thinking about climate change and all of the stresses and changes in the world. Is thinking about a hopeful future can be really hard. I think as a person who experienced a lot of trauma early in my life and growing up, it also was just really hard to imagine a future at all. So yeah, these examples of people who had experiences that you're afraid to ever say out loud, who moved through them, is just so powerful.
Yeah. Now, let's switch gears for a bit. Mental Health America is committed to advancing an anti-racist agenda and promoting health equity. So I wanted to ask you, what do you wish that people knew and what have you learned from being a researcher in this space? Is there some data that you might be able to share with us?
I think there's a number of things. I think there is the kind of social condition side and then how that applies to mental health and mental health interventions. So on one hand, the history of psychiatry and mental health and the medical field is deeply racist. And today, in many ways, upholds that, right? A lot of the research that we have is from middle-class white people. And a lot of the mechanics and the things we're operating with just have never been researched on or supported with or focused on empowering non-white middle-class folks. So I think that there's these huge gaps in even our knowledge base of what works. I think there's a delegitimization of supports and ways of dealing with mental health that communities and marginalized communities have developed on their own. And as a response to the fact that really mental health services have not been accessible and are not accessible to everyone, I think peer support is a really big example of that. We talk about community healing and the fact that that's so powerful and has often been viewed as not as important or not as viable as maybe the kind of traditional like biomedical approaches to mental health. So I think that there's a lot of work that needs to be done in understanding how to better support and engage different communities, whether that's BIPOC communities, whether that's LGBTQ plus communities. There's diversifying the provider workforce. The mental health clinicians are overwhelmingly white, often don't have education around different issues across different communities. And I think a lot of folks from marginalized communities feel like there's this added burden of having to explain a bunch of other things to even get to talking about their mental health. And then lastly, there's also the social conditions. How much of mental health services can be adjusting people to oppressive conditions. And from our perspective, we should be here for a liberatory model and not an adjustment model.
I wholeheartedly agree. And a lot of that comes from funding in the right places too, to change some of these systems, to even, fund research in communities beyond the ones that have traditionally had some of the research done. I wanted to ask you, what are some of the unique challenges that you've seen from your research or from other experience that BIPOC teens and other teens of color might face? What's the data telling us as far as you know, or anything that you can kind of speak to?
Yeah, I mean, one of the really alarming things that has happened over the past few years, we've seen for teens this big increase in mental health challenges, including thoughts of suicide and suicide attempts. And recently, I think there was this idea that marginalized communities were in some way, for different reasons, more protected from suicide. But we're seeing recently huge increases in suicide among Black youth and Indigenous youth. So I think part of it is just the way that data is shown when it's not pulled out by different identities and experiences and really hide the things that need to be addressed. So that even, right, is like making sure that you're really pulling out research and data and prioritizing the experiences and perspectives of marginalized communities. Because if you say all young people are having increased suicide rates, you might do one thing, but if you're breaking it down and saying, actually, there's this really alarming and quick increase in suicide and suicidality among Black youth and Indigenous youth, what does that mean and how do we address that specifically?
Speaking of addressing different problems in different communities, what are some ways that youth can advocate for themselves when they're seeking inclusive mental health care?
I think one of the most exciting advances recently is the growth of a lot of different community and identity specific mental health communities online, because a lot of things that I think people have had to deal with by themselves, there's now a space where you can learn from other people and see how they've coped with challenges. I think part of it is trying to figure out how to navigate resources, but part of it is the truth is that there's limited resources in a lot of places. So what can you learn from other people with shared experiences about how they've coped and how they've found what works for them? I think too, it's even if you're kind of in just trying to figure out what might work for you. So one of the things that we do at Mental Health America is we have an online mental health screening program that's reached millions of people. So it's the same questions that your therapist or your psychiatrist would ask you to diagnose you with depression, anxiety, PTSD. 2/3 of the people who use the site are under 24. And a lot of what they're looking for is how to explore things on their own and just to get information. So I think finding different communities with shared experiences online where you can take steps to feel validated, I think, but also to learn what's been effective for other people in similar situations is really important.
Finding that information and those surveys and just educating ourselves is really important. And I have found those Mental Health America surveys very helpful in my own work. And correct me if I'm wrong, but I think I saw something like in youth ages 11 to 17, they score higher for depression and anxiety than any other age group, which is just pretty staggering.
Yeah, absolutely. And the percentage of young people who report thoughts of suicide nearly every day or most days is also really high. I think one of the things in thinking about how to advocate for change is that there is research that supporting and educating young people directly about suicide prevention and mental health at a school level reduces suicide. There's a project called Youth Aware of Mental Health that has some good data behind it to support its use. So I think one of the things that we're seeing a lot across the country is young people on the policy advocacy side trying to get, and it's working in a lot of places, excused absences for mental health, but also mandatory mental health education in schools. As we're building out more access to mental health professionals, addressing the workforce shortage, all of those things, creating better school climates, giving people language to support themselves and their friends is critical. And I think young people as advocates have a really big role to play in making sure that with the support grid in community and collaboration with adults in getting those resources to their communities.
Absolutely. And I really like what you said about mental health education in schools. That is something that people can advocate for, hopefully with their own teachers, counselors at the district level, whatever it is, because we learn about all other aspects of health in health class, but we don't learn about mental health. And I hope that that changes. I hope that it's already changing. I think it is in some areas. And I just hope that mental health education is going to look very, very different some years from now.
Yeah, I'll just add to that. I think one of the surveys that we did in 2020 was, we know that COVID was very horrible and hard for people. What helped you and what do you want? One of the biggest things that young people, so it was 14 to 24-year-olds, high school age students and young adults said is they want mental health as part of their everyday lives. One of the biggest things that I learned from my lived experience, and I didn't get too much into this, but so much of my time outside of school was spent in mental health services that I had to build kind of my school life, my outside of school life, and then my mental health life. And I think if we're going to address mental health, you shouldn't have to build a whole world and life that separates it from everything else.
Yeah, it should be integrated through all parts of life, the way other aspects of health are. One thing that I've learned about Mental Health America's work is this before stage 4 philosophy. And I was hoping we could talk a little bit about that. I've heard that it's about this idea that mental health conditions should be treated long before they reach the most critical points in the disease process. When we think about diseases like cancer or heart disease, we don't wait years to treat them. Yet when it comes to mental health, many times people don't get the treatment that they need until their mental health conditions are much, much more advanced. They can wait up to 10 years sometimes before seeking care. Now imagine waiting that long to get help for something like an asthma attack or a broken leg. I mean, that would never happen. And so I'm wondering if you could share a little bit more about the before stage 4 philosophy and some of the key takeaways for our listeners.
Yeah, I think just what you said, this idea that for some reason, mental health versus most health conditions, its crisis is the entry point for services. We saw that a lot, especially during the pandemic, is people showing up in the emergency department. And if you're struggling with your mental health, the emergency department should not be where you get started. it's usually years before that you've been struggling before you get to that point. Some of the prevention stuff is exactly what we were just saying about making sure that mental health is integrated as part of schools. I think you mentioned like asthma, thinking about cancer, heart disease, right? Part of how people get early support for those is you regularly get screened. When you go for your annual checkup, when you go to doctors, they do screenings for mental health. We don't really do that. So one big point, or we don't necessarily do that. One really important point and a big point of advocacy is integrating mental health into primary care. So making sure that when you're going, right, most young people, you get your annual physical to play sports, to go to school, and making sure that when you have, maybe you were afraid to ask for support. Maybe no one ever asked you how you're really feeling. So making sure that we're regularly checking in with young people about whatever they might be struggling with is critical. And I think screening, just like we do for other conditions, is an important part of that.
Definitely. And something you said really stood out. Screening doesn't need to mean some complicated questionnaire, right? It could be just asking, how are you doing? How is your mental health? How have you been feeling? Have you had any symptoms? Have you been struggling in any way? And just doing that proactively and doing it regularly.
Yeah. And I think too, the other piece that's really important is having the language as young people to be able to say what's happening. I know that was part of my lived experience and something I hear a lot from other young people and advocates who I work with is I couldn't tell you that maybe I had anxiety, but I could tell you that my stomach hurt all the time. My feelings felt too big. I didn't know what depression was. So there's different ways that if no one's ever explained the language to you, or if as an adult, you don't know what to look for in young people, you might be seeing and hearing it and experiencing it and just don't have the knowledge that maybe might give you access to help.
That's so important. Learning how to identify and label what it is that we're feeling or experiencing, name it, and then express it to others is so important. And learning how some of the things that you're feeling or experiencing shows up in your body, because sometimes it shows up as a headache, a stomach ache, sweaty palms, whatever it is, before you're able to say, hey, I might feel a little anxious right now, or maybe I'm feeling a little bit off. I don't feel like my usual self. Usually some of those kind of body related symptoms, especially for teens and kiddos, and again, some adults, shows up first. And I think the more time and effort and energy we spend trying to learn that language and learn how to identify our own experiences and how to express them, the earlier we'll be able to kind of pick up on some of these early cues so that we're not waiting until those times of crisis to get help, and we're doing it well before.
Totally. Thank you so much for speaking with us today, Kelly. This was such a constructive conversation that'll help a lot of teens.
Kelly, before we go, do you have any advice for our teens who are listening today?
First, thank you for having me. I think for advice, one of the things that for me in my experience and in a lot of the stories that I hear from other people is about finding community. I think there's so many different spaces online and so many different types of advocates and advocacy. If you want to make a difference in mental health, it could be policy, it could be art, it could be sharing your story, it could be working on housing or food insecurity. So I think just trying to learn about as many ways to get involved and finding your people in the world of mental health is really important in, I think, building that hope for the future, but also getting support and connection in the present.
I love that. Thank you so much for spending time with us. It was great to hear about your work and your lived experience and peer support and advocacy and just all things youth mental health. Until next time, this is Dr. Neha Chaudhary reminding you to keep being you.